Just a moment, please.
Poi condividi, ecco qua. Adesso devo andare semplicemente il desktop, condividi. Apri il tuo sezione di sistema. Apri preferenze di sistema. Di metti sul mio. Ce l'hai sulla venire USB. Vedi un po'. Uno di metti sul mio. Adesso ok. Adesso vai sulla presentazione, vale? E fai lancio la presentazione. Esatto.
Okay. Can you see? Okay, I am ready. Hi to everyone. I am Luigi Mauro, and I talk about the sixth cranial nerve through the anterior transpetrosal view. The subtemporal transpetrosal approach, in selective case, is an useful approach to reach the petroclival area. It is considered one of the most challenging approach in skull-based surgery, and the complexity of this approach is related to the complex anatomy of the petrous bone and the many relevant structures to preserve, such as the cochlea, the semicircular canal, the petrous carotid, and the GSPN. And it is a time-consuming surgery, and it has a deep location. In our clinical experience, we reported 2 cases of sixth cranial nerve palsy related to this surgical approach. Why? Probably this structure have a landmark. So we have the arcuate eminence that is a landmark for the superior semicircular canal, and we can find the GSPN with the neurostimulation, and it is a landmark for the petrous carotid. And if we remove the superficial bone, we can have this beautiful view. It is an anatomical picture, and we can know where is the cochlea. The cochlea is anterior to the internal auditory canal, inferior to the geniculate ganglion, and posterior to the petrous, to the first genu of petrous carotid. So, but there isn't a landmark for to identify the sixth cranial nerve. So we had the idea to analyze the relationship between the anterior transpetrosal approach and the sixth cranial nerve in the lab. So the anterior transpetrosal approach was performed on 21 heads, a total of 35 sides. And we taken all these measurements, the distance between the reds of sixth cranial nerve and the inferior petrosal sinus, and the distance between the gasterian ganglion and the sixth cranial nerve before it passes below the Gruber's ligament, and the distance between gasterian ganglion and the superior margin of the Gruber's ligament, and the end, the length of interdural segment of sixth cranial nerve from the dural porus to the Gruber's ligament. This is the result. We can see that the distance between sixth cranial nerve and inferior petrosal sinus is in average 7.9 millimeter, and the range is 5 to 12 millimeters. Another important measurement is the interdural segment. We have seen that this segment has a very wide range from 3 millimeter to 16 millimeter. And here we have all the measurement about the interdural segment. In a lot of cases, we have a short interdural segment, but sometimes we can see that this segment is very long. So the anatomy, the sixth cranial nerve exits from the pontomedullary junction below the level of the inferior petrosal sinus and passes in the prepontine cister to reach the dural porus where it became interdural. And the direction of sixth cranial nerve is convergent to the inferior petrosal sinus at the level of the petrous apex, where the nerve becomes interdural and passes in the sphenopetroclival venous gulf, a confluence of superior petrosal sinus, inferior petrosal sinus, and basilar plexus that join the cavernous sinus. So in this study, we analyze two segments of sixth cranial nerve that are particularly related to the anterior transpetrosal approach, the cisternal segment and the interdural segment. The first one, this segment runs below the inferior petrosal sinus, and there isn't a risk of damage during the approach. As we know, the inferior petrosal sinus is the inferior limit of anterior transpetrosal approach, so we can't damage this portion of the nerve. Instead, the interdural segment run very close to the drilling area with higher risk to damage it in this portion. But the injuries is related to the injuries is probably related to worm by drilling the bone close to the nerve, and we need a lot of irrigation. A lot of irrigation is necessary in the approach. So how we have seen, the interdural segment has a very wide range from 3 to 16 millimeter. So the sixth cranial nerve can pierce the dura farther or close to the petrous apex. So we can have a long interdural segment that it means more way near the periostal dural layer of petrous bone, and probably more risk to heat damage during the drill. And here we have some cases where the interdural segment, we have long interdural segment, and we can see the relationship and the closeness with the drilling area. This is another case. We have a very long interdural segment. We can also see the closeness with the drilling area also in this case. Instead, the short interdural segment means lesser way between two dural layers and more root in the prepontine cister, where the nerve is protected by the cerebrospinal fluid, which can dissipate the heat. Here we have some cases of short interdural segment. In this case, we have the nerve pierces the dura very close to the petrous apex, and also in this case, we have a short interdural segment, and also here we have the nerve pierces the dura very close to petrous apex, with lesser risk to damage it. So the conclusion The risk of damage the sixth cranial nerve during the anterior transpetrosal approach can be related to the individual anatomical variation, and probably the long interdural segment has a higher risk of damaging because the nerve ran very close to the drilling area. And under the trigeminal ganglion, there is the most closeness to the sixth cranial nerve, with probably the higher risk to damage the nerve. So the next step is to calculate the distance of dural porus from the bony surface, and also the distance of the dural porus from the V3. And if dural porus is posterior to V3 or anterior, or it is just below the V3. Thank you for the attention.
Okay. Okay, thank you, Luigi, for this presentation. Someone wants to do some comment about this? Kentaro, are you still awake? What time is that?
Almost 4 o'clock.
Oh, so let's go to sleep.
Yeah. Thank you.